Dr. Richard Buckley, MilfordMD. Remember, this morning's project was Abdominoplasty with vasoring. And I showed you the tailor tacking, and I told you maybe we'd bring you back to see something else. We got busy and we were chatting, and I sort of forgot to bring you back to see something else. What you can see is things completed, and I'll tell you about that. So, are patients awake, yeah?
Yes.
You were totally comfortable the whole time, you said, except for what, the little pulse ox on your finger?
Yeah.
They have a little thing like a gentle clothespin, goes on the finger, and it measures the oxygenation, also the pulse, so it's pulse ox, right? Yeah, everybody has to wear that, so sorry about that. So if that was the most uncomfortable part of the procedure, I feel pretty good about the numbing that we had. So, photographed, marked, numbed with dilute lidocaine. So all we do is numb the areas we're going to work on. We don't need to numb the head. In fact, our patient today took nothing for anxiety. All right? Am I right?
Correct.
Yeah, nothing. Did you take Tylenol?
I did.
You did take a Tylenol. That's big. 2 or 1?
2.
2. Okay. Yeah, I don't know. Maybe it helps. So, but she's wide awake. Played music, talked the whole time. First thing we did after the numbing is I popped under the skin and used a vasor device to actually blast the fat cells off of where we didn't want them. Then I sucked those fat cells out, and they're in a bucket. And then I showed you the tailor tacking, where what I proposed to excise out, it's all shrunk up right now. But this is, if you want gross, this is what it was. And of course, they shrink up after you take them off. Maybe I can show it a little bit like this. But, you can see, top to bottom, it had some height to it. So anyway, took that off. And then did some stitches at a lower level and kind of an intermediate level, and then some really fine intracuticular stitches on the surface. And then we put some medical grade crazy glue on top of the wound, and then some steri strips on top of some other glue, mastisol. And our patient actually is, the staff will help her get dressed, and she intends, as I understand, to go right back to work, yeah?
That's correct.
Maybe use the restroom first, have a lunch?
Yeah, maybe.
Yeah, okay. So restroom and lunch, and then right back to work. So if she had general anesthesia for the procedure, obviously she wouldn't be able to do that. But she feels fine and able to go back to work right now, today. So that's the key point. And that's pretty much really with all of our procedures. And people always ask, so what's the downtime? Kind of depends upon what one means by downtime. I wouldn't want our patient to be doing things that are going to yank the abdomen. It's not a great time to do crunches, although she could do a crunch and it wouldn't hurt anything, but it's not going to help anything. So I kind of lay off the crunches for a little while. But, she's welcome to go for a walk today, and she's welcome to do most things. Since there is an incision here, then there's no going in any bathtubs, hot tubs, ponds, scum, pools, ocean, none of that, until it's totally watertight and sealed up. So let's say about 3 weeks. I wouldn't do this procedure, let's say, with less than 3 weeks ahead of some adventure to some tropical island. I want to do that. Otherwise, good to go to work right now. Any questions, please give our team a call. You'll see our number somewhere, MilfordMD.com. Thank you for watching.